Fibromyalgia, it's a nerve disorder. I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner and chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
Okay. We are going to go over fibromyalgia and explain that it is a nerve disorder, which is amazing to me at this point in time that we still have to explain that. But we're going to outline fibromyalgia in terms of what we know in the literature, and I also think what we know relative to our clinical experience and observations, because we have done, well, I don't know how many fibromyalgia patients we've done, but I mean, we've done just a ton. We've been doing them for probably about, you've been here 7 years, so we started about maybe 8 years. We've been treating fibromyalgia, had a chance to observe it. We're going to share that with you. We're going to talk about maybe something that might be new to you, how small fiber neuropathy came to be associated with fibromyalgia. I know myself, those of you who may have watched some of these, I suffered from fibromyalgia and small fiber neuropathy. I didn't know it. It was all one thing to me. I'm sure it's one thing to you. We're going to tell you why it's important that you know if you have both of those, because there are new insights relative to the fact that half of fibromyalgia patients, approximately at least, suffer from this small fiber neuropathy, and it can influence your path to success of getting better. And there is a path to success to getting better. And there's some new findings relative to some specifics called length dependent and non-length dependent. That means nothing now, but when we get to it, I think you'll find it to be important. And we'll share with you what some future treatments for this condition are being suggested. But I think we'll also probably maybe share a little bit of what we're finding to be consistently successful in these cases. So outline fibromyalgia in terms of symptoms and what we know in the literature. What we do know is most fibromyalgia patients come in here with some sort of degree of post-traumatic stress syndrome. I would say, I think accurately that the vast majority have suffered from some sort of trauma. I was going to say childhood trauma, couldn't say both, some sort of trauma, because it's either physical, verbal, sexual abuse. But we have had people come in here who have been in like a post-traumatic stress syndrome from being in the Gulf War, things of that nature. But you usually have that aspect of it, that trauma, emotional trauma. Usually have a thyroid problem. It's usually misdiagnosed or mismanaged. Usually have some sort of a gut problem. Doesn't necessarily have to be celiac. It can be just about anything that's going to violate the lining of your gut. And somewhere in there, there's an autoimmune attack that has occurred. That's what we know. How does that compare to what we're learning in the literature now? We know that plus what Dr. Gates is going to share with us from his research that he's been doing lately, and relative to kind of updating our protocols and our programs and our understandings of what's going on. And that's what we're sharing with you right now.
So the association between fibromyalgia and small fiber peripheral neuropathy first came about in 2013. We've talked about another broadcast, but we'll just summarize real quick. In that the early publication was in June, then it was finally published in November, Journal of Pain, where they had this epiphany, where they saw that upwards of half of fibromyalgia patients had this condition called small fiber neuropathy. Simply, all you have to know as the fibromyalgia sufferer is that basically your pain nerves are dying and degenerating, which is now being shown to be a source of pain generation for your condition.
The pain nerves in the feet, or all of the pain nerves all over their body?
So it started with them looking at pain nerves in the feet, because those nerves are going to be most affected, because the nerves farthest away from the brain and the heart are going to die first. And that's a common pattern with peripheral neuropathy. However, the newest data has shown that this neuropathy that happens with fibromyalgia patients typically is not blood sugar related. So we've done tons of broadcasts on neuropathy. Half the time it's diabetes relative to small fiber neuropathy. Then lots of times it's pre-diabetes, but the small fiber neuropathy with fibromyalgia is usually not blood sugar dependent. It's usually an autoimmune mechanism. And there are new articles coming out relative to autoimmune small fiber neuropathy showing that oftentimes it can be what's termed non-length dependent. What that means to you as the fibromyalgia sufferer is that the nerves are not just dying and degenerating down there past your knees and in your feet, but they're dying and degenerating all over your body.
So we're talking about nerves, and to take a step back there, this is a significant step forward in understanding the diagnosis of fibromyalgia and potentially improving our treatments of fibromyalgia, and apparently coming up with other treatments. But just to take a step back, when we first started treating fibromyalgia, people didn't yet know what it was. For those of you who don't know what fibromyalgia means, it means pain in the muscle fibers. And for years, it was thought to be caused by a variety of different things, heavy metals and Epstein-Barr virus and all these different issues. And then it came to be determined that the nerve endings in your body were actually being super sensitized by stress hormones, mainly stress hormones, right?
Mm-hmm.
And it's adrenaline.
Mm-hmm.
Is cortisol
Mm-hmm.
part of sensitizing?
Cortisol is part of it, but it's
adrenaline?
more adrenaline was
Okay.
how it was first discussed.
So that adrenaline sensitizes the nerve endings all over your body. I can speak from personal experience. It did sensitize nerve endings all over my body, but my feet were more numb because they'd been there apparently a while. And so these are different types of nerve symptoms.
Right.
So the pain is neurological. The pain is not neural. For those of you, and I've had a few in here lately who didn't know still that it was actually a nerve pain. And then you can go into the mechanisms of, if you want to, of the pain not being filtered out and things of that nature. And then this perpetuates that whole situation.
Yes. So to kind of take things full circle. So back in the early 1990s, when fibromyalgia became, validated as a diagnosis. And for most of you out there with fibromyalgia, I mean, it's 2016, and we still have a lot of doctors out there saying, I don't believe in fibromyalgia.
Just heard one last week.
Exactly, which is what a travesty, because there's so much that's known about fibromyalgia, yet there's still a lot of ignorance within healthcare about this condition.
Mm-hmm.
So back in the 1990s, you as a fibromyalgia sufferer, what are you saying to your doctor? My joints hurt, my muscles hurt, I'm in pain. And so that's what you were telling the doctor. So the researchers started trying to investigate, well, there must be something wrong with the muscles. There must be something wrong with the joints. Time after time, this was shown not to be true. So they said, well, there's nothing wrong with your joints or your muscles. So you don't have rheumatoid arthritis, you don't have lupus. We don't need to create a new type of arthritis for you fibromyalgia patients. And so then other studies started coming about associating traumatic experiences in childhood, hyperactivated stress responses due to increased adrenaline, causing pain nerves to send too many pain signals to the brain. Then other studies started coming out on the brain's ability to dampen out pain being abnormal in fibromyalgia patients. So for example, I don't feel the shirt on my back, but a lot of fibromyalgia patients do. And so they started showing how the networks in the brainstem that shut off pain don't work right in fibromyalgia patients. Lots of times that's due to abnormal sleep. Then they started showing that if you put a painful stimulus or just a normal stimulus into a fibromyalgia patient's hand, their emotional area in the brain will light up. Whereas if you do that to someone who doesn't have fibro, that doesn't happen. Then in 2014, the research became known where they associated autoimmune thyroid disease, something called Hashimoto's thyroiditis, strongly with fibromyalgia patients. So maybe that's part of your fatigue and your brain fog and your depression and your inability to lose weight. And then in 2013, moving forward now, several different specialty centers, several different universities have confirmed the same thing, that a large percentage of fibromyalgia patients, upwards of 50%, have this condition called small fiber peripheral neuropathy, where the nerves are dying and degenerating. And so now we're going to go into more of the newest studies, because it's been validated now, at least 50% of most studies of fibromyalgia patients have this small fiber neuropathy. And then there are some studies saying that it's even higher. So there was one study, for example, where they saw via physical exam that almost all of fibromyalgia patients have this condition. And so the newest study comes from the Journal of Pain. It was actually November of last year, which is not incredibly new, kind of relative to how we do these broadcasts. We're usually finding like the newest articles published yesterday. But in this Journal of Pain, they went in, they took 32 fibromyalgia sufferers, and they took 12 small fiber neuropathy sufferers. So these are patients that have small fiber neuropathy, but they don't have fibromyalgia. And then they took healthy controls. And they did what's termed a biopsy of the tissue, and then they used an electron microscope, which is hundreds of thousands of times more powerful than the human eye. And they saw that the diameter of the nerves for the fibromyalgia patients was considerably smaller even than the small fiber neuropathy sufferers. So these are fibro patients that they now have confirmed as having small fiber neuropathy that are worse than even the small fiber neuropathy sufferers, which is really intriguing in one respect. It's very novel in another respect, and it's highly illuminating in terms of how fibromyalgia patients need to be treated going into the future.
And you just answered my next question, was how is this clinically significant?
This is clinically significant. The reason why we're doing this broadcast and we're kind of beating a dead horse, so to
Clinically
speak,
significant means how does this help you to diagnose and fix somebody?
because we have a lot of fibromyalgia patients watching these broadcasts week after week, and we don't always talk about fibromyalgia, but we have a lot of people watching this, and they need to know that, A, there's something wrong with you, even though everybody's telling you nothing's wrong with you. There's a lot of stuff wrong with you, but this is kind of showing to be one of the primary issues. And if you can understand what's wrong with you, then you can seek a treatment targeted at fixing one of the key problems. And relative to small fiber neuropathy, this is something we work with day in and day out. And you can go back and watch our neuropathy broadcast. No, not everyone with neuropathy can be helped. And if you talk to any neurologist, most likely they're going to tell you nothing can be done for peripheral neuropathy. You have to take the meds, either you have diabetes or you don't, and you're just going to have to live with it. That is the standard spiel, so to speak. What we're finding is that if you get to the underlying metabolic cause and you can electrically stimulate the nerves or using other modalities to bring the nerves back to life, a long-term benefit can be gained, not in everybody again, but in a significant number. And we're whittling down our diagnostic procedures to figure out who can and who cannot be helped. But it's very exciting because we had a fibromyalgia patient start care like a month ago. We have several going, but this was just a great example where she developed joint pains. But her joint pains were actually small fiber neuropathy. It wasn't anything wrong with her joints. Now her joint pains have been gone for like 3 weeks because her neuropathy is improving. And we have objective evidence to show that too. So that's kind of the skinny on the newest data relative to neuropathy and fibromyalgia.
So the same causes that we outline that cause fibromyalgia, pain, and sensitivity of the nerve endings throughout the body, is the same cause that's causing the small fiber neuropathy.
That's a great
and then
point.
The small fiber neuropathy is creating like a vicious cycle by perpetuating the nerve damage in the rest of the body. And one of the earliest signs is formication. You said formication, not fornication. Formication, like a feeling of itching or a feeling of like little ants crawling on the body. Is that correct?
That could be one. Lots of patients report I have a little bit of numbness and tingling in my feet, or they'll just say, I get burning pain in my feet from time to time, or it feels like I accumulate lactic acid in my feet more often, or they itch throughout their entire body. It's been shown that if you don't have a skin disorder and you itch, the next thing you need to look for is small fiber peripheral neuropathy.
And we've mostly seen joint pain up until now as secondary to an obvious autoimmune problem, rheumatoid arthritis, gut problems that seem to stimulate immune responses. We now know Lyme disease stimulates an autoimmune response against the joints, and now this is another addition to our diagnostic arsenal, that peripheral neuropathy. Small fiber peripheral neuropathy in a fibromyalgia patient may be what's causing the joint pain, and you start taking care of the numbness, tingling, burning, whatever your pain is in the feet, and not unlike that patient, that may help to improve the joint pain if that's what is your problem as far as relative to the joint pain.
And we will say carte blanche, we've seen fibromyalgia patients who don't have small fiber neuropathy. So we're not saying it's the case for all of you, but it looks like the overwhelming majority seem to have this component of small fiber neuropathy. And then you may look into this and you may read online that the gold standard test right now is the intraepidermal nerve fiber density test, which is basically they just take out a piece of your skin, they put it under a microscope, and they look to see how many small fiber nerves do you have in your skin compared to a control subject. Some patients don't like to do this. You have to go to a podiatrist typically for this to be done, or a specialty neurology center. For example, most neurologists in our local town, which is pretty decent in size, like 500,000 people, don't do this test. And so there's this new test coming out called a corneal confocal biomicroscopy, which is where they can basically, an ophthalmologist can look at your eye and he can figure out the nerve fiber density of your cornea. He or she can do that. And so they're now doing studies for fibromyalgia patients. We attached one to today's broadcast where they showed that they took a group of fibromyalgia patients. Their corneal thickness relative to the nerve fiber thickness was statistically significantly smaller than normal control subjects. And actually, though you may seem, maybe this type of study seems esoteric, it's actually being employed across the neuropathy world for small fiber peripheral neuropathy because it's just less invasive, it's quick, and it's easy to do. So this is another really, really exciting area for the fibromyalgia patients.
So I'm going to finish up by tossing you a curveball here,
Okay.
or maybe actually a knuckleball. That's a little harder to hit.
Okay.
So I'm a fibromyalgia patient. I'm sitting out there. I see the title that says fibromyalgia. It's a nerve disorder. Okay, I want to see what that's all about because I'm sitting here. My doctor thinks I'm crazy. He doesn't think I have any problems, or I've gone to the doctor. The doctor says, yeah, I think you have fibromyalgia. Here's Neurontin, here's gabapentin, here's Cymbalta, here's Cybele. Oh, it's not working. Here's another one. How does this data help that person? How do they get to where they are to get evaluated? Frankly, most of the patients that come in here are candidates. There are patients who are not candidates, and there's a variety of reasons for that. They may actually have a type of peripheral neuropathy that can't be helped. There are those types. Or they may be very severe on the scale of, I'm taking 15 drugs, I have several of my organs out, my feet are turning black, and things of that nature. That could be a case where you would get very little improvement. And we even had one of those that got pretty well. I'm thinking of the gentleman from up at the lake who was the hunter and the fisherman and the European, the kind of European tough guy from, it was several years ago. But these are the types of things that you evaluate. But how do they get from there to getting, using this data to get a diagnosis and find out if they can be helped? That's a tough question.
It's a tough question because
relative
basically
to this topic, but the topic was presented as fibromyalgia. It's a nerve disorder. I think
it is a nerve disorder.
Kind of giving somebody a little hope here.
One point I would make too, if you don't have small fiber neuropathy, if you're in what we now consider the small percentage of fibro patients who do not have that, just know that it's still a nerve disorder because lots of times the pain has brain implications, as we talked about. So your brain may be interpreting pain differently. Also, they've done studies where the pain receptors, even if you don't have neuropathy, the pain receptors discharge abnormally. And fibromyalgia patients upwards of 80%. So I just want to clarify that point. So let's say you do have small fiber neuropathy, or you think that you have small fiber neuropathy after watching this broadcast. What you can do is you can go to your local neurologist or chiropractic neurologist, and you can ask them, hey, I want to see if I have small fiber neuropathy relative to my fibromyalgia. And they may be well-versed in this new information. Maybe they're not, but see if they'll humor you and see if you can get a diagnosis. If you do have fibromyalgia, likely if you're seeing a medical neurologist, they're probably going to put you on medications like Dr. Rutherford mentioned. Many of these medications you may have already tried, like Cymbalta or Lyrica, or maybe you have or have not had gabapentin. And that's really the direction that the literature, scientific community are going to go, because
more medication.
It's more medication, because that's what everybody's looking for these chronic problems. They're looking for a quick fix. And we just did a radio show 2 weeks ago where we pretty well illuminated how with most chronic problems, there are no quick fixes. Let's say if you don't feel satisfied with those treatment results, then you can pursue seeing a chiropractic neurologist. Those are generally the folks right now who are doing these peripheral neuropathy types of modalities, but some do them, some don't do them. So everybody has a different area of focus. A lot of chiropractic neurologists focus on headaches or dizziness. Maybe they focus on concussions, but not all of them focus on peripheral neuropathy. So you really want to make sure that if you're seeing somebody, they're pretty well versed in peripheral neuropathy, and That would be my
Yeah, I would
answer.
say to pursue it, it's usually going to be a functional medicine doctor or a functional neurologist, not a zillion functional neurologist, chiropractic neurologist running around out there. And don't let the chiropractic part fool you. This is a very sophisticated discipline relative to nerve damage, nerve-related issues, and being able to rehabilitate those things. But I would look at that. I'm a functional medicine doctor. Dr. Gates is a functional neurologist. We put these two together. That's been our success formula in handling both aspects of nerve damage. But I would say pursue it. I would say my answer to the curveball, to the knuckleball, would be, only because I had the advantage of hearing what Dr. Gates said, would be it is a nerve disorder. That nerve disorder, unless it is in the category of what I said relative to these limitations of patients being able to, certain patients being able to not get well, can be helped. There are a lot of people out there helping these types of things. There are a lot of people using different types of electrical stimulations. People are trying it from a lot of different angles. Some people are getting little results. Some people are getting decent results. Some people are getting great results. It's better than getting no results. And it's better than taking the medications, which are altering function over a long period of time. Unless the medications are actually helping you, then it's still a little better option because you're not changing the chemistry of your system. So I think the takeaway is no, it's a nerve disorder. No, it can be helped. Do your research. Certainly you can, well, you can't because we don't have enough time to do that. I was going to say you can always call us, or not call us, you can always email us, but you can't because we're too busy now to be able to take those emails.
It was more the volume of emails. So
Yeah,
as these
the volume
broadcasts
of
have
emails.
grown in popularity, then
So
it became hours a week.
we're going to
year
have
and
a
a half
book
ago,
out on
so.
fibromyalgia eventually at some point in time. But until then, pursue it. Know it can be helped. This is an important factor. If you're going somewhere and your neurologist isn't aware that your peripheral neuropathy getting better could help your fibromyalgia, maybe you could share this with them. You can access these journal references by going to
powerhealthtalk.com. You'll just have to search fibromyalgia. Today's broadcast will probably come up, and then you'll be able to see it, and you'll be able to access the articles at the bottom of the page.
Which means your practitioner can access them too, to see that we're not just sitting here talking about this off the top of our heads to make their life difficult. Okay. So, so this is great data. Please take it to heart. Please follow our instructions, and you may have the potential to actually get out of this dilemma that you're suffering. All right.
Okay. Thanks for watching.
All right. See you next week.